Welcome to this bite-sized presentation, which covers the area of psychological well-being in the context of bariatric surgery. My name is Dr. Elizabeth Samuel. I'm the clinical psychologist for the bariatric service, and I'm going to speak to you very briefly about a few things that you can do to be aware of your psychological well-being whilst undergoing the bariatric surgery program. It's really important that you look after yourself psychologically. Bariatric surgery involves making a permanent alteration to your body and involves lots of lifestyle changes that you will be committing to for the rest of your life. So it's really important that you feel ready for this emotionally and physically. There are some simple things that you can do to make sure that you feel psychologically ready for the surgery. One of those things involves having a really good knowledge and understanding of what the surgery itself involves, the changes that you'll be committing to, and the unexpected side effects that can come up as a result of having bariatric surgery. There's a fantastic book by Denise Radcliffe called Living with Bariatric Surgery that is available on Amazon. It's very digestible, very easy to read, and it gives a fantastic overview of not just the surgery, but of what life tends to look like after the event. As well as doing reading on the topic, you can attend the education sessions on offer and speak to others who have undergone the surgery in order to skill yourself up in having the essential knowledge that you need. The more you know about what you're entering into, the easier the transition will feel. Before and after the surgery, it can be really helpful to make sure that you draw in sources of support. Making sure that you have time off and understanding from your boss and your colleagues is really important, as well as using your friends and family, not just for the emotional support, but for practical support for things like childcare and lifts. And it's really important as well to speak to your dietitian and nurse, both before and after surgery, if any concerns come up for you. Try to time the surgery for a time in your life when there's minimal other stresses going on. Things like moving house or changing jobs or coming off antidepressants can be a really big challenge to manage and something that you don't need when you're undergoing a surgery and learning how to eat all over again and what this new stomach means for you. And remember that there's a really natural adjustment process to undergoing a big life change like a bariatric surgery, where emotions will feel up and down for quite a while. If you were concerned that your emotions were down for a long time and you were worried that you weren't quite yourself, it's really important that you speak to someone about that, whether that be your GP, your dietitian or your nurse, or you can actually even self-refer to your local talking therapy service. There's no need to ask your GP to do this and wait for an appointment. You can look online, find your local service and fill in an online form. It's very easy and quick, and they can offer you support really quickly. If surgery is agreed and you are placed on the waiting list, it's really important to make use of that time and maintain the healthy changes that you've already worked so hard to achieve. Eating healthily, getting good sleep and exercise always helps with the recovery period, and working on smoking and reducing alcohol intake is really key prior to surgery. Make sure that you follow all the instructions to help you feel properly prepared for surgery and the advice that you've been given by your bariatric team. And if you've been working on issues to do with emotional eating or binge eating, make sure that you continue to use the time before surgery well to address any further issues related to these, so that these problematic type behaviours don't undermine you following your surgery. Lastly, if you are undergoing any counselling or mental health support, keep that going, as it's a great source of support to have both prior and after your surgery. Lots of people find that in the weeks and months after surgery, their feelings go up and down, and they can experience a whole range of different emotions. Some people feel very excited and optimistic about this new lease of life. Other people feel that not recognising themselves in the mirror is very disconcerting, And for some, adjusting to the very strict regime of always thinking about your protein, your fluid, weighing your portions, preparing your meals and taking lunches out with you on the go can be quite a lot of work and quite burdensome at times, particularly hard during events such as Christmas or Easter, or when there's a big celebration coming up where food is a central part of that. The loss of food in one's life is not to be underestimated, and in some ways can feel a bit like a grieving process, even if it brings lots of positive changes with it. If you find that your mood is struggling, it's really important to seek support from people around you, from your GP and from ourselves. We provide a follow-up service where we see you at 3, 6, 12-month intervals. And it's important that you use these sessions to talk about your well-being as well as other aspects of your post-operative journey. The advice provided by the healthcare professionals at Maidstone and Tunbridge Wells Trust is all based on evidence and guidelines from BOMS, which is the British Obesity and Metabolic Surgery Society, and also NICE, which is the National Institute of Care Excellence. The information that we aim to provide to you is very specific to you and your needs, takes into account your current body size, your preferences, your lifestyle, and the type of surgery you have. It's not a one-size-fits-all model. It's really important to be aware that some online Facebook groups and bariatric surgery forums may not contain evidence-based information. So sift through it, what feels relevant, and beware of information that might be less relevant for your specific journey. Often our patients support each other and swap numbers whilst in clinic or during their hospital stay, so they can text or WhatsApp each other and get support and share their experiences. This peer support can be really handy, and it's always helpful to know people who are going through the same journey at the same time as you. Thank you so much for listening to this presentation, and if you do have any further questions, please don't hesitate to get in contact with us.